Hello, my name is Joe, and I'll be helping you today with the procedure that you're going to have done. The goal of this surgery today is to help you get rid of your basal cell carcinoma. Basal cell carcinoma are abnormal growths on the outermost layer of your skin, or as other known as your epidermis. They often develop due to an intense exposure and long-term exposure to UV radiation from the sun, and that can be seen, as you live by the beach. So that's understandable. They can look like a reddish patch, a shiny bump, or can be an open sore that just doesn't heal. The doctors that will perform the surgery are specially trained and consists of the surgeons that removes the cancer cells, as well as a pathologist who analyze the lab specimens, and the surgeon who closed the wound. This could be a specialist like an oculoplastic surgeon. So the steps for the procedure are as follows. So it starts with the doctor examining the spot where you had your biopsy done. Then the surgeon injects local anesthesia to numb the area. The top layer is removed using a scalpel, so it could be analyzed in the lab to determine the location of any remaining cancer cells. They make a map of your cells and they see where the cancer cells are at, and then they take them off, and then they may have to go um, into another layer and go from there and remove cancerous cells and find where all the healthy cells are at, so they can keep those. But I'm gonna continue with the step-by-step process here. Just wanted to give you a little, heads up there. So they'll remove any of the remaining cancer cells. Then the surgeon will then inform you where else they need to take that second layer that I was telling you about, where it's needed taken out from. More local anesthesia will be added, and the process will be repeated until all of the cancer cells have been removed and all the lab analysis have been done as well. The process is done various times just so it can be made sure that all the cells are gone, all the cancer cells to be um, specific, that are completely removed. Once that it's determined the site is clear of all cancer cells, the wound may be left open if it's not too big, or the surgeon may close it with some stitches if needed. The entire process can take up to several hours, especially if more than one round is needed to be done. So please be prepared to wait. I would recommend you bring a book, one of your favorite books, or a book that you're reading, some paperwork, anything to keep you busy between times, um, between you waiting after the surgery and the lab results coming in and so forth. It is a precise technique that has the highest cure rate of any treatment method and can save healthy tissue. Carefully follow your doctor's instructions for wound care, scar care, and follow up to achieve the best outcome. Would you like to set up an appointment to come back in 2 weeks to have the stitches removed? And if you have any questions, you're more than welcome to ask me, and I will answer them to the best of my ability. And if I can't answer them, I'll directly speak to those involved in the procedure.